Hey everyone, welcome back to the channel. In today's video, we're going to break down congestive heart failure, or CHF, what it is, what causes it, how it's diagnosed, and the treatment options available. If you or someone you know has been diagnosed with CHF, or if you just want to learn more, stay tuned. Let's start with the basics. What exactly is congestive heart failure, or CHF? It's a condition where the heart isn't able to pump blood as effectively as it should, meaning the body doesn't get enough oxygen-rich blood to meet its needs. CHF doesn't mean the heart has completely stopped working, but it's not functioning at full capacity. This can lead to fluid buildup, fatigue, and shortness of breath, which makes everyday activities much harder. So, what causes CHF? There are a number of underlying conditions that can lead to heart failure. Some of the most common include coronary artery disease, CAD, when the arteries that supply blood to the heart become narrowed or blocked, the heart muscle is deprived of oxygen and can weaken over time, leading to heart failure. High blood pressure, hypertension. Over time, uncontrolled high blood pressure puts a strain on the heart, leading to its weakening. Heart attack, myocardial infarction. A heart attack can damage the heart muscle, reducing its ability to pump blood. Valvular heart disease, problems with the heart valves, like aortic stenosis or mitral regurgitation, can lead to heart failure. Diabetes can damage blood vessels, making it harder for the heart to pump blood efficiently. Other risk factors include obesity, smoking, high cholesterol, and family history of heart disease. Now, let's talk about the symptoms of CHF. The symptoms can vary, but they generally result from the heart not being able to pump blood effectively, causing fluid to build up in the body. Some of the most common symptoms of CHF include shortness of breath, especially during physical activity or while lying down. Fatigue and feeling unusually tired, even with simple tasks. Swelling in the legs, ankles, or abdomen due to fluid buildup. Rapid or irregular heartbeat, also known as palpitations. Persistent cough or wheezing, especially when lying down. Reduced ability to exercise or engage in physical activities. If you or someone you know experiences any of these symptoms, it's important to consult a healthcare provider for an evaluation. So, how do doctors diagnose CHF? The process typically starts with a thorough medical history and physical exam. If CHF is suspected, several tests can confirm the diagnosis. Some of the most common diagnostic tests include echocardiogram, echo. This test uses sound waves to create an image of the heart, helping doctors assess how well the heart is pumping. Electrocardiogram, ECG or EKG, this records the electrical activity of the heart and helps detect abnormalities. Chest X-ray, this can show fluid buildup in the lungs, which is a common sign of CHF. Blood tests, these can check for elevated levels of BNP, B-type natriuretic peptide, a substance that is released when the heart is under stress. Stress tests, these evaluate how the heart performs during physical activity. Once a diagnosis is made, doctors can stage the condition and start planning the best treatment approach. While CHF is a serious condition, the good news is that there are many ways to manage it and improve quality of life. Treatment for CHF typically includes a combination of medications, lifestyle changes, and sometimes medical procedures. Some of the most common treatments for CHF include medications. Doctors often prescribe ACE inhibitors, beta blockers, diuretics, and aldosterone antagonists to reduce fluid buildup, improve heart function, and lower blood pressure. Lifestyle changes. It's important to adopt a heart-healthy diet, limit salt intake, engage in moderate exercise, and quit smoking. Devices and procedures. In severe cases, doctors may recommend devices like a pacemaker or implantable cardioverter defibrillator, ICD, to regulate the heart's rhythm. Some patients may need a heart transplant if their heart failure is advanced. The goal of treatment is to manage symptoms, prevent complications, and slow the progression of the disease. While some risk factors for CHF, like family history, can't be changed, there are plenty of steps you can take to reduce your risk of developing heart failure. Here are a few key preventive measures. Control high blood pressure. Managing your blood pressure with medication and lifestyle changes is one of the most important steps in preventing CHF. Maintain a healthy weight. Reducing excess weight can lessen the strain on your heart. Eat a heart-healthy diet. Focus on foods low in saturated fats, sodium, and cholesterol. Exercise regularly. Aim for at least 150 minutes of moderate exercise per week to strengthen your heart. Avoid smoking and limit alcohol. Smoking and excessive alcohol consumption are major risk factors for heart disease. taking care of your heart today can help reduce your risk of CHF in the future. So, that's everything you need to know about chronic heart failure: what it is, what causes it, how it's diagnosed, and how to manage and prevent it. With the right treatment and lifestyle changes, people with CHF can live active, fulfilling lives. Thanks for watching. If you found this video helpful, please give it a thumbs up, subscribe to the channel for more content like this, and leave any questions or comments down below. Take care of your heart, and we'll see you in the next video. Stay healthy, take care of yourself, and keep learning.